for giving us the opportunity to come and present at this such esteemed crowd of people. Just to give you a brief background, my name is Aakash, Shah, and I have Kirtan on my left. We both are Director Sales, handling sales for the India and the international market, and we'll let you know what eClinicalWorks is today and what products that we have innovated in the US and the global markets and what difference we are making right now in the globe. We'll start with a short AV, and then after that I'll run through past the presentation. I understand everyone's hungry and we want to break for lunch. We'll try and pass through this as quick as we can. Can we have the AV, please? Can we dim the lights?
Who are we? Depending on your perspective, we are electronic medical records, patient engagement, revenue cycle management, or population health. But we're really much more. And that is the definition and the magic of synergy, the creation of a whole that is greater than the sum of its parts. We are a healthcare information technology company. We are a global company with offices in the US, London, and India. We have 9 data centers across the country, so your data must only travel on the shortest path possible. This ensures increased reliability, scalability, greater uptime, and consistent high-speed access. Our network is private and secure. This means your data is your data. We are healthcare, tools that improve access to quality, affordable care, that make the delivery of care safe, measurable, and effective, that help doctors realize a positive return on their investment, and that improve the overall health of our citizens. We are information that is both powerful and personal. Powerful enough to manage the health of our largest cities, and personal, too, providing a unique health record for the more than 200 million patients who have their medical record in eClinicalWorks. We are technology that is always on and always available when and where you need it. Technology that is designed to be used to improve the health of individual patients, to improve the accuracy and efficiency of healthcare providers, and to reduce the cost of healthcare for all of us. We are eClinicalWorks, delivering healthcare information technology solutions for today and tomorrow. It is who we are. It is what we do. Every day, working with you, improving healthcare together.
We at eClinicalWorks are dreamers. We see dreams that don't let us sleep. These are dreams that are going to continue to make newer products and solutions. We're going to take our customers along with us in that journey to build the bridges of care between the providers and the patients.
So we are eClinicalWorks. We are a global healthcare IT company with penetration of 70% in the US market, and we have been doing this since the last 16 plus years. We have offices at 6 locations in US, UK, Dubai, and India. We've been in India since the last almost 8 to 9 years, but we were not selling our software in India since the last 1 year. I would like to walk you through what we are as a company and what products we offer which complement the topic today at eLex. We are basically a private independent company with more than $400 million of revenue, expected to grow at easily 500 by the end of 2016. That's the advantage and the grip that we have compared to any other competitors in the world, because we make decisions and the development of R&D much more faster compared to any other company in the market right now. We have offices in India, which is in Ahmedabad, Mumbai, and Bangalore, with more than 4,500 people working for us. They do global support development. At the same time, there's also a good part of R&D done, and all the teams work hand in hand with our US teams. Offices in 6 locations in US, headquarters from Boston, Massachusetts, and even in the UK. Just talked about the company numbers. We have 115,000 plus providers, which basically means that we have more than 70% of the US population's electronic health records sitting on our data center at this point of time. The top number basically gives you the 70% of the US population. We have more than 50,000 plus hospitals who have implemented our software, not just in the US, but also in the UK, Australia, New Zealand, other European countries as well, including Middle East with Dubai and Saudi. More than 1 million patients visits are recorded in our software every day. I'm sure the number has gone high. And this is the power of the technology that we are bringing to the world, especially starting from US. This just gives you a quick understanding about who we are right now. We have the biggest market share in the US, which is at 11%, which is higher than any other inpatient ambulatory care company. The data comes from HIMSS. The notable customers in the US are Hospital Corporation of America, New York City Department of Health, National Football League, Children's Health Fund. These are pretty big hospitals and organizations out of US. The idea is pretty simple. We've been in this industry since the last 17 plus years, and the goal has been to make healthcare more smarter, convenient, and affordable. So out of US, we have presence in more than 35 countries, and one of the biggest optical clinic centers have opted to go with us called Specsavers. They have 1,700 stores across UK, Europe, Australia, and New Zealand. They've been using our software since the last 2 years now. So we're not old to India. The owners of this company come from Indian origin, which is why all the passion to come into the Indian healthcare market and use the technology that we have developed and which is used by thousands of hospitals and millions of patients. We started our first owned support center in 2007 in Mumbai, which has right now more than 2,500 employees working for it. After that came the Ahmedabad and the Bangalore office, and since last year, we started selling our Indianized software in the Indian market. And we were able to get more than 75 hospitals in the last 8 months. Just to give a quick glimpse of the hospitals that we have on our market, on the map. As you can see, a lot of hospitals are they say southern part of the India. We expect major part of the hospitals also to adopt technology on the north and the eastern part of India by the end of 2016, implementing eClinicalWorks. So we have hospitals in more than 12 states, and I'm pretty sure by the end of 2016, we'll be able to make this entire map of India green with the technology that we'll be being able to provide to the hospitals. Let's talk about now the products that we offer. So eClinicalWorks 10 is basically the product, and it is compatible not just on the desktop or a laptop. You can use it on an iPhone or an Android phone, at the same time on an iOS or an Android tablet. What we've seen in the Indian market is that people, especially the doctors, really want to do things very fast. The accessibility or the application inputs right on the laptop or desktop was not working out, which is why we came out with these smart applications that can be deployed directly on the iOS or the Android tablets, and with just a selection of either A, B, or yes and no, they were able to chart all the clinical notes of a patient in less than 3 minutes, both in the inpatient and the OPD. This is a quick rundown of the products that we offer. So we have a Indianized hospital management information system software. We have an award-winning EHR, electronic health records, which is B10, the ambulatory space used by doctors, especially in the OPD. We have a population health platform as well, where you can do a lot of complex analytics. For example, a hospital wants to figure out how many diabetic patients have not visited my hospital in the last 6 months, and you can run all the data or complex analytics sitting on your HIS, and which also helps in the end to increase the revenue and give that personalized touch to the patient, because now the patient feels that the hospital got in touch with me via, say, an IVR or a phone or an SMS, and they will come to the hospital to increase the revenue. And then we have a lot of patient engagement applications, which is the tagline of ELETS today. where we give the power to the patient, make them the custodian of their own information, and at the end of the day, make them more satisfied. So the first step that we always talk when we are implementing a hospital is that you can start with a hospital information system, which has all the modules, starting from patient and bed management to labs and radiology, emergency department, as you can see, billing, payroll, accounting, pharmacy. So all these departments talk to each other seamlessly. There's a handshake that happens, which makes the paper go away from the hospital. And we were able to implement 75 hospitals in the last 6 to 8 months. The second step that we always teach the doctors who are implementing our software is, once you are well versed with the actual application, you can start using mobile, iPad, or an Android tab, or a Windows tab, and that's much more easier because the interface is much more bigger, and at the same time, the doctors love using the iPads because it's faster to put in the data. This is the application that we've given out to the hospitals, and the hospitals have in turn given out to their patients. The patients can now basically book the appointments, look at their medical history, check in using a QR code right on the kiosk as soon as they are there in the hospital. This is the mobile application which is used by millions of patients right now in the US and UK. We'll be launching soon this application in India. But right now it has been given out to the patients of these 75 hospitals. It's working seamlessly. This is one of the things that we can do, engaging the patients and making them a custodian of their own information, so that creating that dependency on the patient and not just having that responsibility on the doctor to implement the software. Population health is very new in US right now, but we are confident we'll be able to implement population health in India in the next 2 to 3 years once we have gathered a lot of big or raw data. But this is the next big thing which is going to happen, where Department of Health and bigger hospitals will now be able to do a deeper dive into the electronic data which they have and find out ways to increase revenue, or find out ways to basically lapse the gaps between different departments in the same hospital. Finally, what happens is, in India, everyone thinks that the client-server model is the way to go. And after 2 or 3 years of implementation, they understand the use of, or the accessibility, or I would say the security part of going on cloud. We think cloud is the next thing which will happen in the country, and we are heavily investing and contributing to the cloud technology in India. Kiosk is one of the features that we give out to all the hospitals, where the patients can now come in with a mobile application, scan the QR code that tells the doctor who is sitting inside the hospital that the patient has already arrived and the patient is sitting inside the registration desk. We can basically get rid of all the paper registrations which are done at the hospitals right now. We are doing big in terms of telemedicine, and this is software telemedicine. Doctors can basically know everything. As you can see on the right hand side, the patient screen is there, where the patient will be reviewed and diagnosed. At the same time, the doctors can now basically make a note of all the chief complaints, current medications, medical history for the patient. Telemedicine software site has been deployed to more than 10,000 hospitals in the US right now. We have already deployed this technology to 5 hospitals in India, and the market is growing. At the end of the day, we have a very simple goal. We want to make sure it's not just the doctors and hospitals who are taking the advantage of the technology, but at the same time, we're closing the loop on a 360-degree ecosystem, giving that satisfaction to the customer, and making sure they are engaged and, with the tagline, contributing to the patient delight. Thank you very much.
Thank you very much, Mr. Shah. He'll be also joining the panel discussion, followed by Ms. Hedges. I'll request Dr. Lekhi to kindly present a memento to Mr. Shah, Mr. Aakash Shah of eClinicalWorks, for this presentation. A round of applause for Aakash Shah, Director of Sales of National and International Market in eClinicalWorks. Round of applause, please.